Hi, I'm Michelle. I'm an infant feeding coordinator. I'm going to talk today about hand expressing. Hand expressing is a really useful skill to know for many reasons. Some of those being in the early days when you're trying to express some colostrum, just getting those small amounts of breast milk out for baby. If your breasts are full and you need to relieve some pressure and help baby to latch, or if you just need to store some milk, hand expressing is a really useful way of being able to do that. And sometimes people find it easier than using a pump. Before you start hand expressing, you need to think about a few things. Make sure you've washed your hands. And if you're planning to store the milk to give to baby later, have a nice wide-rimmed container that's sterile handy. If you're planning to just express a little bit of milk for comfort, you could do it leaning over the sink or the bath, or even do it in the bath where it's nice and warm and will help with the milk release. You might find it helpful to have baby near you when you're expressing, or if baby can't be near you, a photo or a piece of their clothing. Choose a time to express when you're feeling relaxed, feeling warm, and when it's unhurried, where you don't have to rush off to do something else. Before you start hand expressing, it's useful to stimulate the breast to get that milk release. And you can do things like stroking down the breast, allowing your fingers to brush over the nipple, pitter-patter with your fingertips, or a little bit of gentle kneading. All these things will help to stimulate that let-down release of milk. When you start hand expressing, you need to think about where you need to place your fingers. You need to place your fingers 2 or 3 centimetres away from the nipple to express. Placing your first 2 fingers next to the nipple is a good guide. Make a C shape with your thumb and forefinger and place them in the right position to begin compressing and releasing. And you're just doing a steady compress and release like a heartbeat. You may not see any milk come out straight away, that's fine. Just wait for a few seconds just to see if that milk starts coming out. If it doesn't come out, then you may need to move your fingers either slightly forward towards the nipple or slightly further back, and just continue those compressions. Continue compressing and releasing until that area of the breast is empty and the milk starts slowing down till it's just a few drips. And then move your hands around and express the next areas on the breast. And you'll need to do that a few times around the breast to empty the whole breast. Once that breast is empty, you can switch and do the other side in exactly the same way. If you're using a pump, starting and finishing with a bit of hand expressing can help stimulate the milk and help you express more milk. If you're planning to store your breast milk, then you can keep it in the fridge for up to 5 days if the fridge is below 4 degrees, and keep it at the back of the fridge, not in the door. You can keep it in the freezer for up to 6 months. Make sure you label it with when you've expressed it, and you can even put on the time of day. If you need any more support with hand expressing, then you can talk to your midwife or health visitor.
If you have any concerns about your baby's feeding, contact your midwife or health visitor who will be able to support you.